My name is Krishnamurti. I am the husband of Chitra Krishnamurti, who underwent the surgery with Dr. Satish for the removal of the tumor in the spine. The whole problem for Chitra started in the year 2018 when she was having difficulty walking and she was having no sensation in the leg. And then we went and thought, we consulted some local doctor. He said, you might need to do surgery in the spinal cord because there may be a tumor in the spine and then we need to further investigate. But then when he said operation for the spine, we deferred the matter because most people told us if you do operation for the spine, it's a very risky affair and people normally don't recover from it. So because she was walking, she was able to walk with a walker, we deferred the matter and she continued like that till 2024. And in 2023, we actually went to Dr. Satish again, and Dr. Satish had taken an MRI, etc. And he said the tumor is there, it needs to be removed, and that is the one that is jamming the nerve going to the legs, and that's why she's having difficulty walking. But then again, since she was walking all right, we again didn't want to go in for the surgery because Dr. Satish himself said it is a risky surgery. So then in 2024, a couple of days ago, she was unable to walk. And then since she was unable to walk, we said we have no other choice. We came back to Dr. Satish, and the first question he asked us is, why did you delay it so long? So I said we delayed it because we were worried that surgery, if something goes wrong, she won't be able to walk at all and she might become paraplegic. So he said, no, but now you have no choice. You are left with no option but to go in for the surgery. So then that day when we came to his clinic, she was actually very pale, she was blabbering. The doctor said, take her straight to the hospital, Aster Whitefield Hospital emergency. We need to check her sodium and potassium, etc. They did all that, and from there it was one after the other. They took a brain MRI, etc. And she was in the hospital for the last 10 days, out of which the surgery was done on Tuesday the 24th. And it was a phenomenal surgery in the sense that it's a 10-hour long surgery. Though the doctor told us it is very risky, he really gave his time, commitment, and did a wonderful surgery that, it was so successful that she is now recovering. Now what we need to do is we need to put her through physio, etc. And Dr. Satish said her recovery is very good, so she'll be soon after going through a physiotherapy, etc. Thank you so much.
Hi, my name is Maya, and I brought my mother, Chitra Krishnamurti, to Aster Whitefield for treatment. At first, she was having trouble with walking. We knew that she had a tumor in her spinal cord. We had visited Dr. Satish Rudrappa in his clinic in St. Mark's Road a couple of years ago, and he had advised us surgery. But we were a bit skeptical and not sure because there's a high risk of paraplegia with the surgery. However, over the past 1 month or so, her health deteriorated and she was unable to walk. So we took her again to Dr. Rudrappa in his Whitefield clinic, and he said that she has to be admitted straight away because he suspected her sodium level was low. We brought her to the emergency and she was treated there for a few days before moving her to the neuro ICU ward, and Dr. Satish Rudrappa recommended we do the surgery immediately to avoid further damage. So we are really happy with the surgery, the way it went. It was a 10-hour surgery, but despite the challenges, she's doing much better, and amazingly, within 3 days of her surgery, she was back in the neuro ward and she seems to be recovering very well. We are very, very happy with the quality of service and care provided by Aster Whitefield to her, and thank you very much to all of you.
The surgical team, under the able leadership and guidance of Dr. Satish Rudrappa, were very thorough with the investigation and groundwork before the surgery. By God's grace and hand of the extremely competent team of surgeons, the high-risk surgery was successfully completed without any life-changing complications. And what was more remarkable was that our mother was back to the normal, cheerful self in the last 3-4 days post the surgery. Thank you to the Aster team and to the entire set of doctors for this hard work and efforts.